Thank you, Sean. That was a very nice introduction. I really appreciate that. I'm going to go ahead and put up my slides here for all of us. Okay. Thank you so much for having me. This is actually one of my favorite topics, which is how we can work around our glaucoma in ways that involve something besides just the traditional surgery and medications. There's things that we can do outside of that traditional realm, and a lot of information is not available on this, and I want to be able to present the information to you that has been studied and that you can actually hopefully learn something from. My interest in this actually came out of an article that was published a few years ago in one of the journals for ophthalmologists. And it was the first time I had seen anyone, any doctor, talk about glaucoma and exercise or anything related to lifestyle modifications. Traditionally, when we study glaucoma and when we study ophthalmology, we're studying the basic science. We're learning about how eye pressure affects glaucoma, and we focus on medical therapy and how to do surgery. But a lot of doctors are not trained in how to speak to patients or how to understand some of the other things besides surgery and medications that can help those who have glaucoma. I do also come from a family background where we're from the Far East, and back home on the subcontinent, there's different ways that we manage diseases. We don't necessarily focus entirely on allopathic traditional medicine as we have here in the Western world, but there's also an element of what you can do for yourself. And that's, again, the focus of my discussion for today. So first of all, let's just take a minute to understand what is CAM. So this stands for Complementary and Alternative Medicine. And so I want to point out a few things. Non-mainstream practices that are used together with conventional medicine, that is essentially what complementary medicine is here, and that's what I want to focus on. There are also non-mainstream practices that are used in place of conventional medicine, and I am in no way advocating that we not follow conventional medicine, but that we try to work together as partners in the treatment of glaucoma and other eye conditions with some of these non-mainstream practices. When I think about medicine and the care of glaucoma, I try to focus on integrative medicine, which is also called holistic medicine. This is where we bring conventional and complementary approaches together. We're treating the patient as a whole, as a human. We're integrating the personal components, the mental health, the psychological health, the physical health. We're really putting everything together. And that's how I believe medicine should be practiced, even in ophthalmology. I just want to go over a few articles that I found were interesting. I thought that you all might like to know that glaucoma doctors and ophthalmologists also I want to point out that glaucoma patients, such as yourselves, obviously here today because you're interested in this topic, but ophthalmologists have an interest in knowing how many of you are interested in complementary and alternative medicine, how many of you are actually trying this out, and what are you doing? There has been some work done before, looking at about 1,000 patients in Boston. And what they did was they sent out a survey to the patients and asked them, do you use any CAM? And if so, what do you use? And what they found were that around 14% of patients were in fact using some type of complementary and alternative medicine to treat their glaucoma. One thing that I found to be alarming was that 70% of the patients did not use their provider to get the information. So they were probably using information from the internet or maybe word of mouth. We don't know where they got their information. And that's very tricky because if you just listen to something that is word of mouth and doesn't have any scientific basis, then you don't really know what you're doing and you can actually be causing yourself harm. And when patients were asked, well, why do you try these CAM? People felt, well, okay, I think it maybe halts my glaucoma and lowers my eye pressure, but 13% of people really had no idea. And I think it's important that when all of us work together to treat you in a holistic way, that we really understand what we're doing. Some of the types of CAM that patients that you all told us that you were trying were things like vitamins, vitamin A, vitamin C, the AREDS vitamins, which are actually not for the treatment of glaucoma. different types of herbal therapies, things like ginkgo biloba, also exercise, dietary modifications. Some people were using meditation and relaxation methods like acupuncture and faith healing. Looking at the converse side, how about ophthalmologists? Surveys have also been done of us to ask us, do we think that there's a role for CAM in the treatment of glaucoma? Around 1/5 of ophthalmologists say, yes, I think that there is a role for something besides traditional medicine in the care of my glaucoma patients. Another point I thought was interesting were that of the ophthalmologists, glaucoma specialists were more likely to believe in the role for a complementary and alternative medicine, which again underscores the point that we're treating patients in a holistic way when we treat chronic conditions like glaucoma. The types of things that ophthalmologists are recommending of those who actually discuss this with their patients are very similar to the list I just showed you. So exercise, antioxidant vitamins, eating a good diet, also meditation, amongst other things. And I'm going to talk about some of these dietary factors, and MMJ, that stands for medical marijuana, which I'll also be discussing in a moment. Now, why is anything that I'm saying, why could it possibly be true? I want to point out that eye pressure is not the only thing that causes glaucoma. We actually don't know what causes glaucoma. We're working on all of those mechanisms, but the one modifiable risk factor that we know of is lowering the eye pressure. There are other risk factors that we cannot control, like your genetics. But the one thing that we do know how to modify to date with modern medicine is how to lower the eye pressure. The question I want to ask you is, why are there some people who have glaucoma, and this could be you, who are maintaining your target eye pressure and maintaining a low eye pressure, but your glaucoma is still progressing? Why is that happening? And so we have to look at other mechanisms of what could be causing glaucoma. And although we haven't exactly delineated the paths that I'm going to talk about here, we do know that there is some evidence to suggest that optic nerve head damage and retinal ganglion cell damage can be related to oxidative stress in the body and blood flow abnormalities. So I'm going to go into that. Oxidative stress, when it's produced in our body by reactive oxidative species, can damage the trabecular meshwork, which is the outflow mechanism of the eye, and can then damage the retinal ganglion cells, which are the cells that we need to preserve our vision. Furthermore, with blood flow abnormalities, blood is good for us. It brings oxygen to our entire body. If blood is not going to your brain, it's not going to your optic nerve sufficiently, you could have progressive glaucoma. We see this a lot in those who have something called normal pressure glaucoma, or who develop glaucoma at lower than average eye pressures. So let's first start talking about exercise and why I highly encourage exercise, but it should be the right type of exercise. Just a few interesting things to point out that will go further into this discussion. When we do exercise, that produces a lot of pressure on our upper body, like playing a wind instrument. There's something called the Valsalva maneuver, where we're putting a lot of pressure on the top of our body. We know that that can increase the eye pressure. And there have been studies done that have looked at a group of Boston area musicians and found that those who were playing wind instruments tended to have a worse visual field test than those who played other types of instruments. Something that just kind of provides a little bit more evidence to what I was talking about. Exercise that's very exhaustive. So that's like very heavy weightlifting where you're really huffing and puffing. That type of exercise can actually raise your pressure and make your glaucoma worse if it's done over a very long period of time and it's something that's chronic. A one-time event is not going to make your glaucoma worse. Remember, again, this is a chronic condition. There are other things where you're putting a lot of pressure on the top of your body, like in certain yoga positions. Yoga is great. I practice yoga and I highly encourage all of you to do the same, especially pranayama breathing, which are the alternate nostril breathing exercises. It's very good for us because it helps us to regulate our blood flow. And as I just mentioned, glaucoma progression can be caused by poor blood flow to the optic nerve. So when we're regulating our breathing, we are also regulating our blood flow. Some things to be wary of, though: any type of inversion where your head is below your heart for more than about a minute or two can in fact increase your eye pressure. The good news is that your eye pressure should return to baseline within about 2 minutes. But if you are someone who has brittle glaucoma, maybe advanced disease, you should really think about, okay, should I be doing a position where my head is below my heart? Again, I would not do more than 1 minute. And the great thing about yoga is that it's for all different body types, all different lifestyles. So there are a lot of ways to find modifications. Instead of doing a head down, maybe just doing a position where your hands and your feet are both on the floor and your head is level with your neck. Weightlifting is good for us, especially as we age. The risk of osteoporosis can increase for women and for all of us. So I do encourage weightlifting. Smaller weights are great, 5 pounds, 10 pounds, maybe even 20 pounds. But really exhaustive weightlifting can in fact increase the eye pressure, so be careful. Swimming is also great. I encourage it, but be careful of the types of goggles that you use. If they press on your eyeball, then they are probably increasing your eye pressure and could be causing worsening of glaucoma. What we see in the published literature is that those who participate in regular aerobic exercise, so that's moderate exercise, at least 3 to 5 times per week, can in fact have a decrease in their eye pressure. Now, this evidence is not from a randomized clinical control trial, but there are published there's published literature that does cite that aerobic training, those who are engaged in, again, this moderate exercise, do have lower rates of progression of glaucoma. And one of the mechanisms is by lowering the eye pressure, but also some of the other things we talked about, where we're increasing the blood flow to our body by just generally improving our vascular health. Another point to mention are hormones and how they can affect our body. Estrogen and its analogs can, in fact, protect the retinal ganglion cells. Now, this is very important for us, those of us who are going into the most menopausal years. Estrogen can, in fact, lower the eye pressure. There can be an enhanced blood flow to the optic nerve. And so we have to think about, okay, earlier versus late menopause. And also a question I often get is about the use of oral contraceptive. I do have patients who are still in childbearing years and ask me these questions. So I do want to point out that with oral contraceptive, there is not an estrogen peak that we naturally normally get in our body. And there is not any strong evidence or really anything for me to guide you on in terms of not using oral contraceptive. I do encourage to continue to use it if you desire to use it. But just be aware of some of these factors. And we're still doing a lot of research in this area. So it's hard for me to really guide you in terms of hormone therapy. I can't offer any evidence right now, but I just want you to think about some of these things that can also impact your glaucoma and the research that we're doing in investigating these factors. Things that are very good for you are how you can decrease the oxidative stress in your body. So that's something that you can do by exercising and by consuming antioxidants. So where do we find antioxidants? These are going to be in your diet. Now, the evidence is variable, but I do want to point out that antioxidants, they come from things like vitamin C, E, things that have carotenoids and flavonoids. And I have some slides ahead that will tell you where you can get those, but basically fruits, that's vegetables, and tea. And I also want to point out that I do have references for everything I'm talking about at the bottom of the slides for anyone who wants to write that down and look it up later, but these are scientific articles. Calcium, iron, and selenium. Supplementary consumption of these may be associated with a greater risk of worsening glaucoma, but dietary consumption is not. And so what I really want you to focus on is dietary consumption. We should not get into a frenzy of consuming vitamins. The best nutrients you can get are from your diet. So I encourage you, instead of trying to find a pill on the shelf that helps you with your glaucoma, is to improve your diet. Eat things that have calcium, iron, and selenium. Dairy is great, obviously seaweed, nuts, soybeans, and tofu. And it is okay to eat meat when you have glaucoma. And we'll talk about the nitrogen oxide in just a moment, but I do want to just to point this out, that some of the factors in these dietary things that we have are important in reducing the oxidative stress in our body through enzymatic mechanisms. Other really good sources of antioxidants are asparagus, avocado, spinach, and broccoli. I basically tell people the more darkly green something is, the better it's going to be for you. It's going to be good for your glaucoma. It's going to be good for hopefully protecting you also from things like macular degeneration, and also just keeping you healthy overall. Carotenoids are found in green leafy vegetables also. Papaya is a great source, corn, egg yolk, but of course be careful if you have an issue with cholesterol. Carotenes can be found in carrots, pumpkins, peach, apricot, and again, dark green vegetables. So I think that term keeps coming up, dark green vegetables. Flavonoids are things that you can find in dark chocolate, red wine, especially berries. One of the best things you can do for yourself is to eat berries and use oregano in your diet. That is like a real antioxidant punch. You should maybe try it sometime. Berries sprinkled with oregano. All right, citrus, fruit, of course, and tea. I found this very interesting. There was actually a study that looked at different ways that we consume caffeine. And the summary, or one of the bottom lines of it, was that hot caffeinated tea could potentially be linked to a decreased risk of primary open-angle glaucoma. And so what I generally tell people is that if you're not drinking hot caffeinated tea, then maybe you should start. It doesn't matter if it's a black tea or a green tea. It should just be a caffeinated tea, and it should be hot. And why exactly hot and not cold, I'm not sure. It was not elucidated in the study. There was no association between the consumption of coffee, any decaf teas, or soda. And the reason why is because caffeinated teas have a type of an acid in them, which may be protective when it comes to glaucoma and help us to decrease our risk of progression. Okay, and then what about coffee and just caffeine in general? Drinking coffee can increase the eye pressure. It depends on, again, how much you're drinking. But it can increase the eye pressure by anywhere from 1 to 4 millimeters of mercury over about an hour and a half. I do have some patients who come to me first thing in the morning. They've had a cup of coffee, maybe 2, some people even more than that. And we notice that their eye pressure is higher than it is at other times of the day, or maybe on a previous visit where they were not drinking that much coffee. And the reason that we came up with was, okay, maybe it was from the coffee. And so then I tell them on the next visit, don't drink as much coffee, or maybe just drink half a cup. And then they come in the next visit, their eye pressure is suddenly so much better. So I'm not telling you not to drink coffee, but maybe just modulate your consumption of that a little bit. Coenzyme Q10. This is actually a very potent antioxidant, and we believe that it does have neurotherapeutic effects as well. Coenzyme Q10 does decrease in the retina as we age. It's a very important cofactor in something called the electron transport chain, which is an important reaction mechanism in the body. It maintains the support of the synthesis of again, important molecules in our bodies, and can help to protect us from the oxidative stress that can be produced in our bodies as well. And a great source of coenzyme Q10 is going to be in meat, fish, vegetable oil, parsley, an herb called perilla, and avocado. I know I said this earlier, but I do want to get the point across that we often find these things as supplements on the shelves of our pharmacies and at grocery stores, but you really want to try to get this in your diet. There is really no evidence for ginkgo biloba leaf extracts. I've had lots of people ask me questions about ginkgo biloba because it is known to be an antioxidant. They have studied it in those who have dementia, particularly Alzheimer's disease. But again, I wish there was more evidence for it, but there is not. We know that ginkgo biloba does have some neuroprotective properties, and ocular blood flow can be increased. But be very careful with ginkgo biloba because it can also increase your risk of bleeding. So if you're someone who's prone to bleeding, then you should avoid it. And just be aware that if you do supplement your diet with ginkgo, that it will increase your potential risk for bleeding. So be very careful. If you're having any type of a surgery, whether it's the eye or some other part of your body, you should disclose to your practitioner that you are taking ginkgo, because they will probably ask you to stop it. So again, there's really no conclusive evidence about the use of ginkgo, but we know that it does help with a few things, like with blood flow and the neuroprotective factors. Nitric oxide is important in blood flow regulation, so vascular regulation and the dilation of our blood vessels. That is good because, as I mentioned earlier, blood flow abnormalities can worsen glaucoma, especially in those who have normal pressure glaucoma or who are progressing even though they're meeting their target eye pressure. This has actually been associated with a lower risk in those who have visual field defects affecting more of the center of the vision or just below the center of the vision. Sources of nitric oxide are, again, green leafy vegetables, so salads, kale, charred spinach, mustard, cruciferous vegetables, which are things like Brussels sprouts, cauliflowers, basically things with that look like a little tree, broccoli, kale, cabbage, some of the things that were mentioned earlier, and also root vegetables. So those are things like potatoes, sweet potatoes, carrots, yams, and beets. And also the potential for tomato-based foods to also have nitric oxide and be helpful for us. Omega-3 fatty acids are also good because of their effect on the blood flow. And so essentially, you can get omega-3 from flaxseed, fish oil, and walnuts. When looking at the publications on omega-3 versus omega-6, it was omega-3 that was potentially protective, not omega-6. So just be mindful of what type of omega acid you are getting. And I would say that one of the most common questions I get is about the role of marijuana in glaucoma. I think this is a funny picture. I'm sure I'll get in trouble later. But anyways, medical marijuana, it is not endorsed by the American Academy of Ophthalmology, the American Glaucoma Society, or the Canadian Ophthalmologic Society. I do not know of any ophthalmologic society that endorses the use of marijuana. We all know that marijuana is available for many medicinal uses. And the reason why it's been suggested that it may help with glaucoma is because it can lower the eye pressure. For marijuana to lower the eye pressure, it must be inhaled. It only lasts for about 3 to 4 hours. And what that means is that you'd basically be inhaling that several times a day. And so you'd be high all day, and you couldn't do things like drive a car, go to work, really do anything. You'd probably gain a lot of weight. So I do not recommend marijuana. I know that it is available. That you will go to a dispensary and they may tell you that they can prescribe it for you for your glaucoma, but again, it does not have a sustaining effect on treating glaucoma. Also, I'll tell you to be very careful with the tinctures that you can get, the CBD. There haven't been any human studies with CBD, but they've looked at some animal models, and in those, CBD can actually increase the eye pressure and worsen glaucoma. So be very careful with CBD. A lot of people use it for massages, maybe to go to sleep, but I'd be careful if you're someone who has brittle glaucoma or progressive glaucoma. Meditation, believe it or not, is one of the therapies that I recommend for the treatment of glaucoma. And there's actually been some great published work on this and presentations at our national and also international meetings. And the reason why meditation is good for glaucoma and other chronic conditions is that it reduces the cortisol levels in our body. Cortisone or cortisol is one of the stress hormones. When we're stressed out, it really goes up. And it can increase the eye pressure and set off a bunch of other mechanisms that have the potential to worsen glaucoma. So people ask me, oh, I'm really stressed out. Do you think this is making my eye pressure go high? Do you think that's why my glaucoma is getting worse? And although we don't have any strong evidence to say, yes, stress is what's making your glaucoma worse, we do have some early evidence and So this is some of the work that I'm going to present to you right now about how meditation and relaxation methods can in fact lower the eye pressure and reduce the risk of progressive glaucoma. Meditation, it reduces the cortisone in our bodies. It also helps us to regulate the blood flow in our body. I talked about yoga earlier and breathing exercises. So that can increase the blood flow to our optic nerve, to our brain, and hopefully prevent oxidative species from also getting into our bodies, oxidative factors, sorry, I should say, from affecting our bodies. And there was a very nice study that was done in New Delhi at one of the major medical centers there. And what they did was they had patients who had glaucoma do a meditation practice for 45 minutes, 5 days a week, for about 3 weeks. And they saw that those who went through the meditation program versus those who did not, who also had glaucoma, they looked at the stress markers in their body and eye pressure, and they saw that the patients who had engaged in the mindfulness meditation practice actually had lower stress markers in their body and a lower overall pressure. I do want to also point out that meditation and reducing stress in our body is also better for our brains. We see that those who are more stressed out tend to develop dementia earlier and have a cognitive decline. Also, the quality of life is just generally far worse for those who are stressed out. And when your quality of life is worse, everything really just goes down. How you feel about yourself, your desire to comply with medications, your ability to comply with medications, really it's just a downstream effect. And this is one of the figures that was in that paper that I have just cited about how yoga and meditation, it can improve your whole quality of life. It can decrease your cortisol. And we know that those who are really stressed out probably have higher cortisol levels, and thereby then high eye pressure. And there's lots of reasons why meditation is good besides our eyes, like our propensity to have a reduced risk of cardiovascular disease, diabetes, really just so many great benefits of meditation and stress reduction. So the take-home points that I have for you today is diet and lifestyle factors are important in the management of chronic diseases. Glaucoma is a chronic disease. The people that you work with when you go see the eye doctor, they are your partners in this. They're going to be with you. You're going to work through this together. But it's not just a one-time thing where you go and you're seen. You should maintain the relationship you have with your providers and maintain these healthy lifestyle factors for as long as you possibly can. There is really variable evidence. Again, nothing I presented today was from a randomized controlled clinical trial. We do need to put those together. The reason why we don't have those yet is because simply patient recruitment. So if you're someone who's interested in this, then let's speak. Let's talk about how we can recruit more patients. Let's talk about how we can put together big studies. There are studies being done in the US and abroad, but we just don't have the final results yet. Medical and surgical therapy does remain the mainstay of treatment. Good health has so many benefits. You should really talk to your doctor before you try anything new. Please don't go to Dr. Google and start typing things in. Listen to word of mouth or information by a non-healthcare provider. You should really try to go to the source. And there are some places where you can get more information that I wanted to point out to you. As Sean mentioned earlier, I do have a podcast with my colleague, Dr. Harry Quigley. It's called Diagnosis Glaucoma. We have a website. It's diagnosisglaucoma.com. You can find all of our episodes, which I believe now we have 44 episodes. And these are patient-oriented podcasts. They're for you. They're for your family. There are episodes in there, I believe, around 27, 28 about diet and lifestyle. I also wanted to point out that the World Glaucoma Association did do a webinar on diet and lifestyle. I believe it's from May of 2021. You can find that information by going to the WGA or World Glaucoma Association website under the patient section. And you can actually log in and listen to the previous webinar recordings. I found that Australia has excellent resources for patients. So if you go to the Glaucoma Australia website, they also have information about diet and lifestyle. What I find really nice about the World Glaucoma Association and the Australia website are that they are collecting information from experts all over the world. Because I hate to say it, and again, I'll probably get in trouble for this, but we don't know everything here in the West. We should really try to work together with specialists who work out in the East and different parts of the world to figure out how to best manage this condition. Also, the Bright Focus Foundation has really good information, and I also recommend them as well. So now I'll take a break. I am sure there are lots of questions. If you want to know more about this work and other work that I'm doing and that we're doing at Johns Hopkins, you can reach out to Kathy Engelmeyer. She's my development officer, and I have her phone number and email address listed here. And now I will turn it back over to Sean. Thank you very much for inviting me to participate in today's webinar.
All right. Thank you so much, Dr. Kaleem. So we do have some time for question and answer. I see some folks have already used it, but if you have a question, you can enter it into the Q&A box, which is going to be at the bottom of your screen. Additionally, if you would like to ask your question verbally, you can also raise your hand, which you can find under the More tab, which it looks like 3 little dots, and we'll give you power to talk, and I'll go through that with you all, okay? So the first question I am seeing, Dr. Kaleem, are there negatives towards being a pescatarian? Plenty of greens you mentioned, but no positives of meat, pork, or chicken. Would that good outweigh the bad of being a pescatarian as far as dealing with glaucoma?
I don't think so. I think that you can still get what you need in the diet. So if you have a pescatarian diet, that's actually great. You're getting omega-3 fatty acids. And certainly all of the vegetables I mentioned earlier should be a good source of getting antioxidants and nitric oxidative species in your, sorry, when I say species, it's a very scientific term. I'm not referring to an alien, but nitric oxide in your body, basically.
All right, wonderful. Are there any fruits or vegetables that we should err away from?
That's a good question. None that have come to my knowledge.
Okay, so eat the rainbow, right?
Yes. I think, I mean, not really fruits or vegetables, but we all hear it from those around us. Try to cut down your consumption of things that are fried and I would say very carb rich. Notice that I didn't mention things like rice here or pasta. Not that they are harmful, but just try to increase your diet with the things that are actually good for us.
Right. And somebody has asked, why is it so hard to find a cure to glaucoma? And is there a latest research on curing this?
We have a lot of great research that's being done. I would say that the barriers to finding the actual cure for glaucoma it's simply just related to time and technology. So the work that we're doing is it moves from animal models to human models. We have to make sure everything is safe before we can try it in an animal or in a human. And so it's really just how the body works. Glaucoma is a chronic condition. So what we're trying to do is we're trying to replicate the human body and what happens over a certain period of time to try to determine how we can halt this. I can tell you that there is work being done in stem cell therapy. We're doing that here at Johns Hopkins. My colleague, Dr. Tom Johnson, is doing that work, as are some others around the United States. So we're working on it, the main limiting factor is really just time and how things have to transition from the lab to the human.
Thank you. That was really, really helpful. All right. So we do have a couple people with their hand raised. Carol, I see you have your hand raised. Could you unmute yourself?
Okay, can you hear me?
Yes, ma'am.
Yes.
Go right ahead.
Okay. Um, because I've had kidney stones, um, I've avoided caffeine and wine, anything that dehydrates me. Now, I had kidney stones. I did have surgery for parathyroid, and there was a growth, so I may not have the kidney stone issue anymore. I'm not sure. Uh, but I'm wondering, and I was a little confused in the talk about coffee and whether so I'm all the time I'm drinking decaf tea and decaf coffee. because of my concern about my dehydration. So am I doing the wrong thing? I'm not sure. I'm not sure I fully understood what you said about coffee and caffeine and tea and caffeine.
When it comes to coffee, depending on how many cups of coffee you have in a day, a caffeinated cup of coffee, which sounds like you're not.
Just what?
Caffeinated cups of coffee, the more that we drink, have the potential to increase our eye pressure. So decaffeinated coffee is certainly fine, and decaffeinated teas are also fine as well. Caffeine in and of itself does not, it doesn't harm us, but there are certain reactions in the body, certain hormones that get released when we drink an excessive amount of caffeine. So I think if you're doing decaf, then you're actually just fine.
Okay, thank you.
All right, and I see somebody with the name Loestelig. You can just unmute yourself.
I think that's me. I use voiceover to type my name in, and
Perfect.
I don't think I got it. This is Keeloff.
Oh,
Sorry.
Keeloff, go ahead.
I take low dose aspirin to protect me, against the heart and I guess brain and all that. Does it do anything for the eye? Low dose aspirin?
It does not actually do anything for the eye, but taking aspirin generally keeps your blood thin, and that may help prevent. Just like we can get a blockage of a vessel to our heart, we can get a blockage to one of the blood vessels of the eye. So you are not harming yourself in any way. You are not affecting your glaucoma in any way. But it's actually a good thing if you take aspirin just to keep the blood flow good in your body.
Thanks a lot.
All right, thank you. Harris, if you want to ask your question.
Yes, hello, Dr. Kaleem.
Hi.
Hi. It just struck me that almost all of your recommendations are the same that any doctor would give for almost any other disease. So I'm wondering what's unique about your recommendations as far as addressing glaucoma rather than the plethora of diseases that we have.
Well, I think you just hit the head on you hit the nail on the head, which is that all of these things are good for our body, but they're also good for our eyes, just like a systemic disease like diabetes or high blood pressure can actually impact our eyes as well. And what I presented was looking more specifically at ophthalmology and glaucoma patients. These were articles that were published in ophthalmology journals, because there hasn't really been a lot studied in that area, but you're actually correct. And what I'm pointing out here are just the things that can potentially help your whole body and also help your glaucoma in the same way that a disease that harms your whole body can also affect your eyes. A lot of doctors in general don't talk to their patients about diet and lifestyle. Ophthalmologists tend to focus on the eye and medications and surgeries for the eye. And I just really wanted to get this point across, that there are things that you can do for your overall health. And I'm very happy to hear that your other doctors are talking to you about these things as well. And hopefully that lessens the burden on the ophthalmologist. But I think that we as ophthalmologists should also be counseling folks about all of these things.
Thank you. Thank you.
Right. Thank you, Dr. Kaleem. So we have been getting a couple questions. If this is recorded, the answer is yes. Can we share the slides? Dr. Kaleem, would it be okay if I shared the slides for the presentation?
I can make a PDF and then you can share them that way.
Perfect. Yes, that way they can't be changed up.
Mhm.
Yeah. Okay, you mentioned, Diana asked, you mentioned glaucoma is the thief of sight. That was myself, due to the fact that there's a lot of not early symptoms that you'll notice. But the question is, are there symptoms that we should be aware of?
You know, the problem with glaucoma is that a lot of the symptoms are silent, except for a condition called angle closure glaucoma. In angle closure glaucoma, a person may be more prone to getting headaches, eye pain, eye redness, especially when they go from a well-lit room to a dark room, or a dark room to a very well-lit room. We can generally feel like the spasm of our eyes as the drainage outflow is closing. But in terms of the major type of glaucoma, which is open angle glaucoma, you really cannot feel the symptoms. I would say that it's important to start getting an eye exam if you have a family history at about the age of 40. Generally, if you're going to get glaucoma, it's usually around the age of 60-ish, but there are certain risk factors that can predispose someone to getting it earlier. So that's why I bring up the age of about 40 to start getting checked at least once every 1 or 2 years.
All right, thank you. And one thing that we've been hearing more of in the community is I have thin corneas and I'm a glaucoma suspect. Could you enlighten on what exactly that means?
Sure. So the cornea is the window of the eye. The machines that check eye pressure actually touch the cornea. And if someone has a very thin cornea, then the eye pressure reading we're getting is falsely low. So if you have a thin cornea and your eye pressure measurement is falsely low, and you don't get the rest of the eye exam besides eye pressure, so you don't get your optic nerve looked at, then you could be getting missed. We know that there are people who have a quote unquote normal eye pressure, and they are at risk for glaucoma because of the size and shape of their optic nerve. So when you get an examination, you should try to get a complete examination that includes a check of your optic nerve and a dilated eye exam. If you're known to be someone who has a thin cornea, you should always take the eye pressure reading that you get with a grain of salt because of that factor. And again, it really just underscores the importance of getting that dilated eye exam.
Thank you. And I see, Wilma, you did ask a question in the question box, but you also raised your hand. So would you like to ask your question verbally?
Can you hear me?
Yes, ma'am. Go right
Okay,
ahead.
I'm not used to these, these systems. Thank you. That was an excellent. I had optic nerve damage even before I developed glaucoma with high pressure. And then it got worse, I guess, with the glaucoma. I think I know the answer, but I think I will ask it anyway. Is there anything that can be done, or any vitamins or whatever you're talking about, to strengthen the optic nerve and keep it from further damage aside from dealing with eye pressure?
Not a vitamin that you take directly by mouth. I know that there are a lot of vitamins that are out there. They say that they're for your eye health. Those are not for glaucoma. Those are for a condition called macular degeneration. So that vitamin that you're looking for is not quite out yet for those who have glaucoma. But just in general, maintaining a healthy diet is the most important thing.
Okay, thank you.
Okay. Frank asked about, and I believe this may be related to glaucoma, but it's maybe not. He'd asked about strengthening his iris muscles. First, does our iris have anything to do with glaucoma? And then also, can you strengthen those muscles by exercises?
So the iris, it is a muscle in the eye. I think about it as like the aperture of a camera. So it opens and closes and allows the light to go in and for us to get a picture. The things that cause the iris to move that happen in our everyday lives are related to light and also stress. When we go out into bright light, that aperture is going to close because it wants to try to protect your optic nerve in your eye from getting damaging light rays. When you go into the dark, that aperture opens, so your iris gets bigger. And the reason why that happens is because when it's dark, you need to see more, so you really need all the light that you can get to see better. When the iris moves like that, what can happen is that the outflow system of the eye, which is called the trabecular meshwork, can get plugged up. And that's not going to happen to someone who, like, just on every day is going from a dark room to a well-lit room. But if you are someone who has angle closure glaucoma in your family, or you are predisposed to angle closure because of the anatomy of your eyes, which you would not know about, only a doctor can see that under the microscope. But if you have those risk factors, then I think you should be careful when you go from these well-lit to dark conditions. Other things can also make our pupils dilate. Certain medications that we take, same thing can happen. Our pupils can get smaller. Those who take anything with an opioid component, their pupil can get very small. And there are other things that can make your pupil get bigger. or make that eye muscle change. So antihistamine medications can do that. So you have to be very careful to take antihistamine medications if you are someone who's at risk for angle closure. I hope I answered the question correctly, but there's not anything that I really recommend that you do to exercise your iris muscle. There are problems with your ability to read up close. If you try to do something where your iris gets smaller all the time, it will impact, again, your up close reading vision. And then if your iris is always big, it will impact your ability to see far away. It will make everything seem more blurry because of all the exogenous light coming in. So that's like a very detailed detail-oriented question. Hopefully I answered your question correctly, but essentially, no, there's no exercise. And my bottom line is just be careful if you're someone who's at risk for angle closure.
All right, Dr. Kaleem, thank you so much. If we don't have any questions, one question I have for you, are you taking on new patients? And if so, how can people get in contact with you?
I'm taking new patients all the time. I work at several different offices. If you don't want to go to Baltimore, that is understandable. We are there for you in Baltimore with our flagship Wilmer Eye Institute, but we also have satellite locations located all over this area. I primarily work out of our location in Bethesda, Maryland, which is right by the NIH, very close to Montgomery Mall, for those of you who know Montgomery County. I also practice in Columbia, Maryland. Our building is right next to Howard County General Hospital. And we have offices all over. We have 8 different glaucoma doctors at the Wilmer Eye Institute spread all over the state, from Frederick to, to Baltimore, the Pikesville area, Bel Air, White Marsh, Odenton. So we're really all over.
All right. Well, thank you so much, Dr. Kaleem. This was a really great presentation, and I appreciate you taking some time with us today. And for those of you on today, if you want to catch this again, we will share the recording so you can listen again and also share with your friends and family. Thank you so much and have yourself a great rest of your day.